Hi, this is Gaylene Hansen, a nurse living and working in New Zealand and coming to you with emotional freedom technique, EFT tapping, which is a simple tool that you can use to address what you may be feeling and give you some relief. In this video, we'll be tapping on the theme of wanting to be there for those I care for. And like in each of the other videos I've done, we'll be tapping on the points on the body and not on the face, in line with our current recommendations. And you can use this whether you're in your work, if you have a few moments just to do for yourself, or before you go on a shift, whenever it works for you. If you're using protective gear, if you're in protective gear, you can still do a little bit of tapping for you. Please remember that when listening to these videos, that you are responsible for yourself. If you need support, you can reach out to colleagues, to those around you, to me, for someone who will be able to support you. And as I've mentioned in the other videos, if you don't want to use words, you can just tune into your feelings and just tap through the points and breathe. I guide you to where do you feel this in your body? Do you feel it in your throat where you can't speak out? Or do you feel it in your heart or your gut? Or just maybe your mind is just full of just so many thoughts. When we can breathe and when we can tap, we bring our frontal cortex back online, our thinking part of our brain. And we can help to move ourselves out of a fear or out of overwhelm. And then we can do the work that we know, what we've been trained to do, and we can think clearly. So tap along with me on the side of your hand. Even though I want to be there for those I care for, to be their support when their loved ones can't be here with them, I still can have a little time for myself to tap and breathe and settle myself. But even though I want to be there for those I care for, to be their support, I accept that sometimes this is hard, and I feel it in my body. I know it in my thoughts. But I accept that I'm feeling it right here and right now. That even though it's hard, when I'm in protective gear and I'm caring for people who are so sick or people who haven't got their loved ones, I can tune into my heart. I can show I care. And I know that they will feel it. I can share the love that I feel in the care that I give them when I'm gentle, when I'm loving, when I watch and I listen for the signs of the person I care for, what they're telling me, even if they're on a ventilator. I can watch and I can feel love and give the care that I know that I can give and that I would want to receive right here and right now. Let's tap through some points. I want to show I care. I need to show I care. I need to show it for me. I need to know. I'm doing the job I'm trained to give. And I give for me as well. And I tap. And I settle myself. So I can do this. So I can give the love, the empathy, the care, even though sometimes it's hard. I want to give care. I know I can give. And I can settle myself. And I can feel into my body. I can feel and know and find strength. Be there for the person I'm caring for. To connect with them when their loved ones can't be with them. But I'm here and I will give my best. I can do this. I can find the strength. I can find that strength right here and right now. And I can take a breath. And I can feel into my heart. I can speak the words from my throat that the person I'm caring for needs to be able to hear. I can hold their hand. I can do all the other things that I do. In this amazing work. It's love. When we care for somebody. And I can be grateful I'm here with you. To support and love you and care for you and all the experiences that you are having. Their patients, what do they feel? I can breathe with you. I can breathe as you breathe. We can breathe together. And if it resonates with my client, my patient I'm looking after, and they give their permission, maybe I can tap with them too. Or I can just breathe with them. And I accept I have these feelings right here and right now. I can choose how I respond. To move out of my fear. To move out of my overwhelm. And give the care that I know I can give. Place your hands over your heart. And just breathe in and out. If you're someone who feels like you need a color for safety, you can wrap that around yourself. Bring your color for safety in around you. And know that you're doing an amazing work. Is it work? I'm not even sure that it's work when I'm caring for somebody. As a nurse, when I can give and be there for them. Take this moment and take a few more breaths for yourself. With love to you, Gaylene.